What the heck is going on in this image to the right? From the top to bottom, it looks like we have cells. And as we move down, it looks they're degenerating? Is that apoptosis occurring? We're going to talk about it. My name's Anthony Wheeler, MD, and I'm going to tell you everything that you need to know about pathology. Specifically in this talk, we're discussing cell death. Buckle up, there's lots of things to know. Make sure you have this book written by yours truly. It covers the vast gamut of pathology, specifically from a medical student perspective, everything that you need to know to do great on your coursework and to make sure you excel on step 1. If I was you, I would have gotten a long time ago. Cell death. The hallmarks of cell death is the loss of the cell nucleus. The mechanism of nuclear loss in cell death includes pyknosis, karyorrhexis, and karyolysis. Pyknosis, karyorrhexis, and karyolysis. Now I know you're saying, what the heck does that mean? Well, I'm going to tell you. Why am I telling you? Because you have to know the difference between the three. You will be asked. Pyknosis means nuclear condensation. Karyorrhexis means fragmentation. And karyolysis means dissolution. Now there are two mechanisms for cell death, and those include apoptosis and necrosis. Apoptosis and necrosis. Now, both of those mechanisms lead to cell death, but it's important to know how they lead to cell death and the difference between the two. So let's start off with some general terminology. For my philosophers out there, apoptosis means the falling of leaves, right? In Greek. Now, apoptosis is programmed cell death, and apoptosis utilizes ATP. Some examples of apoptosis include the removal of cells during embryogenesis, or cyclical endometrial shedding during the menstrual cycle. Apoptosis is also utilized by CD8 positive T cell mediated killing of virally infected cells. And you can tell under the microscope that cells that are undergoing apoptosis because they appear eosinophilic sometimes, right? Apoptosis is mediated by caspases that activated proteases and endonucleases, basically to cut up cellular membranes and cellular structures. Specifically, the proteases break down the cytoskeleton. Proteases break down the cytoskeleton, while the endonuclease cleaves cellular elements. Caspases are activated by 3 pathways that you must know. Those are the intrinsic mitochondrial pathway, the extrinsic receptor-ligand pathway, and the cytotoxic and T-cell mediated pathway. Intrinsic, extrinsic, cytotoxic, and T-cell mediated. Regarding the intrinsic mitochondrial pathway, we know that BCL2 inhibits apoptosis. Let this sink into your brain. BCL2, I'm going to have to fire my editor. BCL2 inhibits apoptosis. In the intrinsic mitochondrial pathway, BCL2 is inactivated due to cellular injury, DNA damage, or loss of humoral stimulation. Cytochrome C leaks from the inner mitochondrial matrix into the cytoplasm and activates caspases because PCO2 does not stop the cytochrome C from entering the inner mitochondrial matrix. Now, this is important to know. Keep in mind BCL2, because when we talk about lymphomas, specifically follicular lymphoma, you will understand why the negatively impacted BCL2 leads to follicular progression to a pathologic state. But let's get back on this extrinsic receptor-ligand pathway. In the extrinsic receptor-ligand pathway, FAS ligand binds FAS death receptor, or CD95, on the target cell, which activates the caspases. Tumor necrosis factor is also involved by binding the TNF receptor on the target cells, which leads to activation of caspases. The extrinsic receptor-ligand pathway is utilized by your immune system regarding negative selection of T lymphocytes in the thymus, right? Remember, that's where the T lymphocytes are educated. Now, cytotoxic CD8 positive T cell mediated pathway. T cells create pores in the membrane of target cells utilizing perforin. It's like a little drill that CD8 positive T cells have, and they find other cells with viruses in them, and they're like, we're not having that. So they put this drill on them. Perforin, gonna get in there. Then those T cells send granzymes through the pores, which enters the targeted cell and activates caspases. Now those caspases, right, that caspase activation within the targeted cell leads to their demise. Man, those CD8 positive T cells are cold. And guess what? You're cold because you finished one of the more boring lectures, right? We're starting off real boring, talking about CD8 positive T cells. And if you finished the prior lectures, man, hats off to you. You probably have porphyrins. I appreciate your attention. Hopefully this helps you in your understanding of pathology. I'm sure it does. Make sure you have the book. Make sure you're subscribed, have access to all the ancillary material, because there's updates and different information there, right? And you're going to succeed. Just keep studying. Good luck.